If you've been told you might need chemotherapy for lymphoma, you've probably heard a string of names that sound more like passwords than treatments. R-CHOP, BR, ABVD, and it can feel overwhelming fast. This video is here to slow that down. I'm going to explain chemotherapy treatment for lymphoma in plain language, what these regimens actually are, why there are different ones, and how doctors decide which treatment to use, not to overload you, but to help you understand what's happening, because clarity really does reduce fear. Hi, I'm Joey. I share cancer education and real-life experience to help patients, caregivers, and survivors feel less alone and less afraid during diagnosis and treatment. I'm also a patient. I was diagnosed with stage 3 non-Hodgkin's lymphoma, specifically follicular lymphoma. I want to say this clearly up front. There is no single standard chemotherapy treatment for all lymphomas. And that's not a bad thing. It means it's tailored. In this chemotherapy treatment video, we'll cover what chemotherapy actually means in lymphoma, why there are different chemo regimens, the most common chemo treatments you'll hear about, and how doctors decide which one makes sense for each person. You don't need to memorize anything. This is about understanding the big picture. When people hear the word chemotherapy, they often imagine one intense, identical experience for everyone. But lymphoma chemotherapy works a little differently than many solid tumors. Chemotherapy for lymphoma is often given in cycles, sometimes combined with immunotherapy, designed to target fast-growing cancer cells while allowing recovery time in between. And here's something important. Not every lymphoma needs aggressive chemotherapy right away. Some are slow-growing and monitored at first. So when doctors talk about chemotherapy treatment, they're talking about a strategy, not just a drug. One of the most confusing parts of lymphoma treatment is hearing all these different names. The reason there are multiple chemotherapy regimens is because lymphomas are not all the same. Doctors consider things like the type of lymphoma, Hodgkin versus non-Hodgkin, whether it's slow-growing or aggressive, the stage, your overall health and blood counts, and whether immunotherapy is part of the plan. So instead of one-size-fits-all chemotherapy, doctors choose from established regimens that research has shown work best for specific situations. Let's walk through some of the most commonly mentioned chemotherapy treatments, just at a high level. R-CHOP. This is one of the most well-known regimens, especially for certain non-Hodgkin lymphomas. R-CHOP is actually a combination of chemotherapy drugs plus immunotherapy. Each letter stands for a different medication. People often hear this name and panic, but it's used because it's been studied for decades and refined over time. Bendamustine plus Rituxan, often called BR, is commonly used for some slow-growing lymphomas. It's actually the regimen I received first for my non-Hodgkin lymphoma. Like most lymphoma treatments, it's given on a repeating schedule and is designed to balance effectiveness with tolerability. ABVD. This regimen is most commonly associated with Hodgkin's lymphoma. Like R-CHOP, it's a combination approach that has been carefully studied and adjusted over many years. The key takeaway here is not the letters. It's that these regimens exist because doctors are trying to match treatment intensity to the disease. A lot of people ask, why this chemo and not another one? Doctors usually look at how fast the lymphoma is growing, where it's located in the body, whether symptoms are present, lab results and imaging, how your body is likely to tolerate treatment. This is why two people with lymphoma may receive very different chemotherapy treatments, and both plans can be appropriate. It's not guesswork. It's decision-making based on evidence and individual factors. It's completely normal to be afraid of the chemotherapy side effects. But here's something many people don't hear enough. Modern chemotherapy treatment for lymphoma is often very different from what people imagine, based on stories from decades ago. Support medications, dosing strategies, and monitoring have all improved. Side effects can still happen, but they are managed proactively, not ignored. You're not expected to just tough it out. If you're facing chemotherapy for lymphoma, I want you to hear this. It does not mean your body gave up. It means there is a treatment plan designed to help you heal. Understanding your chemotherapy treatment doesn't make it easy, but it can make it less frightening, and you deserve that clarity. If this chemotherapy treatment video helped you feel more grounded or informed, liking it really helps this channel reach others who are searching for answers. If you want to learn about my experiences with an IV and a chemo port, or a deeper dive, I'll link videos here. And if you want ongoing support and plain language cancer education, subscribe. You don't have to figure this out alone. Thank you.